Hello everyone, I am Dr. Amal and today we have a very special guest with us, an ICU nurse, Methmali. Methmali, thank you for joining us today.
Thank you, Dr. Amal. I'm excited to be here and share my experiences as an ICU nurse.
Great, let's dive right in. Our topic today is empathy in nursing, the heart of healthcare. Methmali, could you start by sharing your understanding of empathy and how it plays a crucial role in your profession as an ICU nurse?
Absolutely. Empathy is at the core of nursing, especially in the intensive care unit where patients are often facing critical conditions and uncertainty. As an ICU nurse, empathy is about being present with the patients and their families during their most vulnerable moments. It's about understanding their fears, worries, and emotions while providing care with compassion and understanding.
Well said, Methmali. Working in the ICU can be emotionally demanding. Can you share some strategies you use to maintain empathy and cope with the challenges that come with the territory?
You are right. The ICU can be emotionally intense. To maintain empathy, I try to remind myself that each patient is an individual with unique needs and emotions. I actively listen to their concerns and fears, which helps me tailor my care to meet their specific requirements. It is also essential to debrief with colleagues and seek support from our team to cope with the emotional toll of the job.
That's a thoughtful approach. Methmali, let's talk about a specific patient case. Can you share a situation where your empathy made a significant difference in a patient's ICU experience?
Certainly. I once had a patient who was critically ill and had been in ICU for an extended period. He was feeling disconnected from the outside world and was struggling emotionally. I made it a point to sit with him regularly, taking about his interests and hobbies to create a connection beyond his medical condition. This small act of empathy gave him a sense of companionship during a challenging time, and he shared that it made a positive impact on his mental well being.
It's incredible how simple gestures can have profound effects on patients' well-being. As an ICU nurse, you work in a high-pressure environment. How do you handle the balance between being empathetic and ensuring medical procedures are carried out efficiently?
It can be delicate balance for sure. As an ICU nurse, patient safety is my top priority, but I also recognize the importance of emotional support. I try to communicate transparently with the patients and their families, explaining procedures and what to expect. By addressing their concerns, I find that patients often feel more at ease, which can positively impact the outcomes of medical interventions.
That sounds like an effective approach. Now, let's discuss the impact of empathy on the overall healthcare team. How does your empathy as an ICU nurse influence the collaborative efforts between different healthcare professionals?
Empathy plays a crucial role in fostering teamwork and collaboration among healthcare professionals. When we understand and respect each other's perspectives, it creates a supportive environment where we can communicate effectively and work together seamlessly to provide the best care possible. Empathy helps us from a strong bond with our colleagues, which ultimately benefits our patients.
Collaboration is indeed essential in healthcare. Finally, Methmali, what advice would you give to aspiring ICU nurses who want to develop and maintain empathy in their careers?
To aspiring ICU nurses, I would say that empathy is a skill that can be cultivated, strengthened over time. Always take the time to actively listen to your patients and their families and try to understand their emotions and concerns. Put yourself in their shoes and treat them with the same care and compassion you would want for your loved ones. Remember that being an empathetic ICU nurse not only positively impacts your patients but also brings fulfillment and purpose to your career.
Very wise advice, Methmali. Thank you so much for sharing your insights and experiences with us today. It's been a pleasure having you on the show.
Thank you for having me, Dr. Amal. It was a pleasure to discuss the importance of empathy in nursing.
And thank you to our audience for tuning in. We hope you found this interview enlightening and gained a valuable insight into the world of nursing. Until next time, stay healthy and empathetic. Goodbye.